Hi, I'm Ravi Boja. I'm the director of the Anesthesia Patient Simulation Program here at UT Southwestern. All our anesthesia simulation offerings take place in a 49,000 square foot state-of-the-art facility on West Campus Building 3. A portion of the simulation center is dedicated to housing 20 standardized patient exam rooms where our residents go and practice OSCE exams on a yearly basis. Once a year, we relieve all the CA3s of their clinical duties and invite them to the Sim Center to participate in a mock OSCE. The OSCEs are now part of the board certification program, and we have 8 rooms set up with standardized patients, and the entire CA3 class rotates through those stations. Each station is manned by an anesthesia faculty, so there's about 8 to 10 faculty available. Also on the day of the OSCEs, we host a point-of-care ultrasound or POCUS workshop for the CA3 class. We have 2 to 3 critical care attendings that are available with standardized patients and ultrasound machines to guide the residents through obtaining transthoracic echocardiography images on actual patients. Each year during Vapor Camp, the rising CA1 class comes to the Sim Lab for an entire week and spends the week with us participating in a variety of high-fidelity scenarios. Our goals are to teach them how to manage hypotension, hypertension, tachycardia, bradycardia, and hypoxemia, and kind of go over basic algorithms to manage these crises. Another goal of Vapor Camp is to teach the residents how to engage with the surgeons, know when to call for help, and to immerse them in environments and clinical situations that they'd encounter their first several months going into residency. The crown jewel of our anesthesia simulation program is resident simulation. It takes place every Tuesday. There's an AM session and a PM session, and within each session there's 3 residents that attend. The mixture of residents includes CA1s, 2s, and 3s, and the group of 3 residents work together to manage a perioperative crisis or event. Each resident has about 4 simulation exposures per year. So over the course of their CA1, 2, 3 years, there's about 12 to 15 exposures to the simulation center. Our simulation operating room is representative of a real operating room and has all the equipment that a real operating room would have. Immediately adjacent to the operating room is a control room with a one-way mirror. Inside the control room is our simulation tech who communicates to the faculty anesthesiologist via two-way audio communication. The simulation tech is capable of manipulating blood pressure, heart rate, and oxygen levels with the scroll of a button on a laptop. A lot of this is done on the spot in response to how the residents are performing in the simulation. Each high-fidelity scenario lasts about 10 to 15 minutes. The goal of each simulation is to replicate common perioperative events that the residents are likely to encounter during residency and in private practice, but also to touch on some of the zebras that they may not see during their training. So each simulation lasts about 10 to 15 minutes, but the true learning takes place in the video-assisted debrief that follows afterwards. All our simulation faculty have taken simulation instructor courses either at UT Southwestern or around the nation and are certified simulation instructors. So during the debrief, there's 2 primary objectives. One is to learn the clinical pathophysiology and pharmacology behind the management of the perioperative crisis, but the greater emphasis is over team training and molding the residents into effective leaders, especially in the setting of a crisis. Simulation can be an anxiety-provoking event. Number 1, the residents are being videotaped. Number 2, they're working in front of their peers. And number 3, they're dealing with a perioperative crisis with a lot of ambient artifactual noise and sounds and distractions. The overwhelming objective of our simulation training program is to impart team training principles. We use a construct called Team Steps, which is developed by the Department of Defense and the AHRQ to help healthcare providers more effectively manage a crisis. Our simulation offerings focus on 4 of those main pillars of Team Steps, including leadership, communication, mutual support, and situational awareness. There's a lot of literature to support the formation of episodic memory or enhanced memory in the setting of a little bit of stress or anxiety. So part of our purpose and goal is to develop or engage a resident in an environment that will provoke some degree of stress. But at the same time, we debrief afterwards and try to alleviate that stress so that real learning can take place.